Well, good afternoon and welcome back to Nurses Speak. This is Tonya, and this is the channel for Black nurses, nurses of color, and it's open to all nurses to talk about anything. This is your channel where no topic is off limits. So like, subscribe, and share. And this afternoon, we have a very special guest. We have with us today Dr. Kimani Norrington-Sands, licensed clinical psychologist out of Los Angeles, California. Her practice is Lifting as We Climb Consulting. And Dr. Kimani works specifically with Black women in healing from toxic environments. So given that this is Mental Health Awareness Month, what more appropriate for us to discuss the way to identify toxic work environments? Because as you know, as nurses, we commonly find ourselves in environments that are toxic, okay? But sometimes we don't know that that's what they are, actually. We know how we feel, we know how it affects us, but we don't know exactly what to call it and what's causing it. Even worse, we don't always know how to navigate that environment, as well as how to bring ourselves out of it so we can heal. So that's why I'm so happy to have introduced Dr. Kimani to be our guest today, to just talk about her expertise in dealing with toxic work environments and how we can help each other to get through those difficult situations. All right, so Dr. Kimani, if you just want to say a little bit about your history and background and what led you to focus on Black women and needing healing in toxic work environments.
Okay, thank you, Tonya. Well, first, thanks for the invitation to be here. Again, I'm Dr. Kimani, licensed clinical psychologist in Los Angeles. And healing is just important to me, just personally and professionally. So that's a lot of what I do, particularly professionally with Black women. The issue of toxic work environments came in because I was experiencing a toxic work environment, and I noticed the impact it had on me physically, mentally, spiritually, and the impact that it then carried over on my family. And the more that I experienced it, I reached out to friends and families, and they had similar experiences. And so part of my healing journey, I always want to emphasize that healing is possible, and I want to show people that. So I started doing a YouTube series about Black women healing from toxic work environments. At first, it was workplace bullying, but then it became more expansive because a toxic work environment can go past workplace bullying. So I started doing these conversations with other Black women because I didn't want it to just be about me, right? I wanted it to be a platform for other Black women to talk about it. And, you know, we've talked about this, Tonya, there's so much overlap between the different experiences that Black women have in these work environments, these toxic work environments, and the impact it has on us, right? Has had on us. So some of the things that we see many times is, you know, physically, you know, just not wanting to get out of bed, you know, just dreading that, you know, like that sense of just heaviness in your body, right? I noticed for me, my hair started falling out. I started getting like nosebleeds, and I never had nosebleeds before. Eating more. So what kind of things are going on in your body? You know, that sense of tension also, difficulty sleeping. So there's physical signs that your body is telling you you're not happy, because we know that as Black women, that we just go, go, go. We handle things. We're always the workers. We're the strong ones. And we handle things, and sometimes we ignore the physical symptoms. But it's so important for us to pay attention to that, particularly when we think about nurses, because we need you, right? The other thing is that Black women, I read a study that we're dying at younger ages because of these external stresses, such as toxic work environments. So it's so important for us to be aware of what may be contributing to our physical health and do things to address it so that, a job is not worth your health. A job is not worth anything in that degree. So if it is a toxic workplace, what can be done? Can anything be done to make it better? Or if not, are there plans or maybe considering plans to exit either that particular department or that particular employer, or go somewhere else, right? Because it's not worth your health, and it's not worth in terms of the impact it has on your family. So that's the physical. The mental kind of carries over too, right? So that sense of dread, that sense of unhappiness about your life and about your job, and just feeling stressed all day. I remember my guest last week talked about, she literally felt all day at work that she was holding her breath. And so that contributed to other symptoms. But just imagine what that's like all day, feeling like you're holding your breath or feeling like you're masking. You can't really show who you really are. And so you're kind of like pretending, all day. That takes a toll on us too. It's emotionally draining. And so when we think about the environments that we're in, the work environments that we're in, are we being treated with respect? Are we being valued in terms of what we're contributing? And if not, then that can contribute to feelings of depression and anxiety, and even sometimes trauma. I know for me, my work environment was so toxic that it became a trauma trigger. It was traumatic. The work environment was traumatic, but also it became a trauma trigger to my other traumas, particularly my childhood traumas. And so things like that is not healthy, right? So when you go to work, we go to work to try to serve people in the different ways that we do. But if we're being harmed, we have to stop and pay attention to that.
Exactly. Right. So would you say, Dr. Kimani, that if a person finds themselves in a toxic environment and their role is to be a healthcare provider, a caregiver, and working in the healing capacity for others, it becomes much more difficult if that individual is also in a place where they need healing, right?
Absolutely.
They're the recipient of the toxic environment and what it entails on themselves, right?
Absolutely.
So now they're in a position where, as you said, they may feel like they can't breathe. Because here it is, they have to give something that they're not getting out of their own environment. And at the same time, they're suffering from the effects of that, right?
Yes.
So what would you say are some of the things? Okay, we mentioned the physical symptoms. So for someone who may be in a toxic environment and not be aware that that's what it is, what are some of the red flags in a work environment, particularly in the healthcare sector, that one should be aware of to know whether or not they may succumb to some toxic behaviors or attitudes or culture in the workplace?
Yeah. Well, first is if you dread going to work, if you literally dread going to work. I've had people talk about crying on their way to work and their way leaving work. Feeling like work, everything related to work dominates everything you think about. So even once you leave work, you're still thinking about work. You're talking about work at home. People in your family know everybody at your job in a negative way. And they're like, oh my God, this is just too much. And you might hear your friends and family say this to you, like, man, that job is really stressing you out. So those are some of the just kind of basic types of things. And also, if you notice that, becoming a nurse, becoming a psychologist, anything in the healing field, it's not easy to become these things, right? We have to go through a lot of training. We have to get licensed, all these different things. So just think about all you went through to become a nurse. And so when you start questioning, why am I doing what I'm doing? I get no pleasure out of what I'm doing. And you start questioning your own abilities. You start questioning why you're in this field. That's another sign of being in a toxic work environment. Another one might be, you might notice that you're starting to become like the toxic people in your environment. And
Mm,
so you're thinking, this is not me. This is not how I normally am. But you're kind of falling into that toxicity also. So it's important to just be really aware of how you're feeling and really connecting to how you're feeling, and
mm,
really taking the next step of, why is it that I feel this way? What is contributing to why I feel this way? And because we work and we spend so much time at work, work might be a major factor in terms of contributing to our well-being and our mental health.
right. And I think also you mentioned workplace bullying, and I know
Hmm.
that's something that many nurses talk about experiencing among their
Hmm.
peers.
Hmm.
And, you know, can you just talk a little bit about what does workplace bullying look like?
Hmm.
And, you know, what are some ways that a person who's experiencing workplace bullying can deal with that?
Yeah. And it's tricky because sometimes workplace bullying could be more overt things, like, you
Mhm.
know, um, people calling you out your name, or people threatening your job, right? But sometimes it could be the more subtle things that they're doing, like the gaslighting, to make you
Right.
question yourself. Like, did I
Mhm.
do that right? Then you're second guessing yourself all the time. So you always feel uneasy. But basically, bullying is any type of behavior that's unwanted, it's pervasive, right? And it makes you feel bad. And feeling many times that you are alone and that you have nobody to go to, because this person generally has some type of perceived power over you. So a lot of times you feel stuck in that space. But I want to remind everyone that you're not stuck. You do have choices. I don't care if the person's your so-called superior or not. You do have choice, okay? Because I don't want us to feel like we don't, because then that leads into depression and all that.
Exactly, exactly. And also too, I know sometimes someone may experience social isolation at work as well,
Mm-hmm.
because believe it or not, even in the healthcare sector, people tend to behave much like they would in high school. There's little cliques, and
Mm,
you're either with the in group or you're on the outside. And it's sometimes, there's a racial element to it as well.
mm,
If you're one of a few people that are of color in your workplace, you may
mm-hmm.
not be equally accepted by your white peers,
Mm-hmm.
right? You
Mm-hmm.
have the same title, maybe you're doing the
Mm-hmm.
same job, but when
Mm-hmm.
it comes to, social gatherings or, lunches or things of that nature, conversations about what's going on,
Mm-hmm.
sometimes it's the person of color, the Black person, that is not included in those conversations or in those
Mm.
social settings. So I
Right.
feel like isolation is a big part of that toxic work environment also,
Right.
wherein, the facility or the organization may present an
Mm-hmm.
all-inclusive, diverse atmosphere, but in
Mm-hmm.
reality, that's not the case for each
Right.
person there. Every person's experience is different. And,
Right.
as I said, sometimes that's along, racial and cultural lines as well,
Yeah.
which can create a feeling of isolation and,
Absolutely. And
non-acceptance,
alienation, exclusion. Yes. And we think
exclusion.
about mental health.
Exactly.
A big part of mental health is a sense of belonging. So if
Yes.
you feel like you don't even belong there and you're being ostracized, then that takes a toll on your mental health. And we think on the flip side, having positive social connections, that's a buffer to negative experiences. That's a buffer to toxicity. So when you don't have that, that buffer in the workplace is not there. So that's
Yeah.
why it's so important to have those social connections.
Yes. Yes. And in terms of mental health, um, what are some of the strategies we can do? Because I find that, most people, as you said, they worked hard for their credentials. They went to school, they went through their clinical training. They may
Mhm.
have thousands of dollars in, academic fees and maybe even loans, and they have to work, right? We're in a
Yes.
position where we have to work.
Yes.
We have families to support, things to do,
Mhm.
and we may not be in a position to change where we work, you know.
Mm. Mhm.
Um, and so for someone in that situation where it may be difficult to get out of the situation without, a significant amount of planning
Yeah.
or finding ways to orchestrate a move,
Yeah.
what would you suggest would be some of the things they can do to kind of help maintain themselves and really be at peace and have some balance and equilibrium just to get through their workday, right?
Yeah.
Because
Yeah.
I mean, let's face it, some of us are fortunate enough to just walk away from one job and walk into another. Not
Uh-huh.
necessarily it's going to be a better circumstance, but at least you've given yourself a little breathing room with some
Mhm.
kind of a change, right?
Yeah.
But for those of us who really are in that phase where we're just sitting and waiting, what can we
Mm.
do?
Yeah. Well, first, I want to say it's important to think of it in terms of a both and, right? So it's not like either I leave my job or if I don't.
Yeah.
But I think it's important also to recognize that it may be unrealistic to think that you're going to experience any level of peace in a toxic environment, right? Because if you're constantly being assaulted and harmed, no, you're not going to experience peace. So being real with yourself about that, right? The other thing is going into the job knowing this is going to be challenging. What kind of things do you do before you get to the job? What kind of things do you do on your way to the job? What kind of things do you do at the job and after the job? So what is your wellness plan, right? So if it's, on your way to work, you're listening to music that you love, right? When you're at work, you're taking moments of deep breathing. You don't have to take a break for that, right? Deep breathing, right? And then after work, what are you doing after work in terms of discharging all that toxicity, right? Do you go for a walk? Do you call a friend? What are you doing also, right? And then I do this thing where I started doing with my toxic workplace is that I made my home my sanctuary space. So when I came home, those toxic people from my job, I wouldn't even talk about them in my home, right? Because in my home, this is my safe space. So having boundaries for that, or if you say, you know what, I do need to talk about it in my home, make a boundary for yourself about, okay, I'm going to talk about this for 30 minutes. That's it, right? Because you don't want this to kind of pervade everything else you do. And then also make sure that you're doing things that bring you joy, right? So I'm looking behind you, Tony. I see flowers. I love flowers, right? So what are the things that you can have in your home environment that gives you a sense of joy, whatever that might be? But make sure that you incorporate that. So that's the one end, right? The
Yeah.
other part is recognizing that even though you may feel stuck, we do have choice, right? And so it may not be just leaving that job one day, right? But maybe start thinking about your exit plan, right? And it may take years for the exit plan to actually come to, realization, but start thinking about your exit plan and start making steps towards your exit plan. Because when you do that, it gives you a sense of, okay, I'm making a way to get out of here. And it gives you a sense of hope because many times we don't feel we have choices. It feels very hopeless. And that's a very negative place to be in.
Yes, yes. I would absolutely agree with that because I have found myself in a situation like that on more than one occasion, working in a toxic environment. And, just thinking about leaving or thinking about doing something different, moving, repositioning myself, right?
Mm-hmm.
Um, things, even that shift, that paradigm shift in thinking begins to put things in motion
Mm-hmm.
wherein that exit plan can become a reality, right?
Mm-hmm.
And as you said, it does build hope
Yes.
because now you have something else to think about other than the situation that you're currently in. And I like what you said
Exactly.
about having a wellness plan as
Mm-hmm.
well, because I feel like that's something that a lot of healthcare professionals do not invest in. They do not invest in themselves to have a wellness plan of what
Right.
they can do to maintain their health and wellness,
Yes. Yes. Yes.
mentally and physically, even spiritually, right? To
Absolutely.
have a balance in life wherein
Mm-hmm.
work does not occupy all their time, or thoughts of
Mm-hmm.
work does not occupy all their time. And I know
Mm-hmm.
that's difficult for nurses because, when a nurses finish a shift, typically it's like you're going through this mental exercise of trying to make sure and remember, did you do everything you needed to do?
Mm-hmm.
Did you pick up all those orders? Did you write all
Mm-hmm.
those notes? Did you administer all those medications?
Mm-hmm.
Did you perform all those treatments? Did you
Mm-hmm.
return all those phone calls?
Mm-hmm.
Did you make sure all this lab work got done? And, there's so many different things
Mm-hmm.
that you need to constantly be checking and double checking and following up on, that you can leave work and for
Mm-hmm.
hours after still be thinking about things that occurred during work, right? Just
Wow.
make sure you covered all your bases for each of
Mm-hmm.
your patients, and anything else that may come up. So it's particularly stressful in that respect because, we haven't set those boundaries, right?
Mm-hmm. Mm-hmm.
So that's a key plan. And I'm glad you brought that up, because I think that as clinicians, we need to have more strategies and more defined boundaries on
Mm-hmm.
leaving work at work, right?
Right.
And not
Right.
bringing it outside into the rest of our lives.
Right. But you raise a really good point. As a nurse, yes, you need to double check and make sure everything is taken care of, right? But once you leave the job, that part's over, right? So it's not like you thinking about it more can change it. Maybe like take a note, put it in your phone about what you may need to follow up the next day about, but keep thinking about it at home. It's not going to do you any benefit anyway. And so, it's important for us to remember as Black women that, we deserve joy. We go through so much as Black women, just as Black women, to maintain any sanity in this crazy world. And just think of just what that is. And then to have this expertise as a nurse, we need you. And so thinking about, wow, I deserve some semblance of joy in my life, and I will not allow anything to rob the joy from my life. I'm not going to do it. Right. And so it takes practicing, and it even might take like accountability joy partners, right? So, like checking in one another. Hey girl, what you doing? Da-da-da-da-da. Let's do this. And I'm not saying spend money. I'm not saying anything like that. I'm saying, what are we doing to really support and hold each other accountable about reclaiming our joy? It's really important.
Yes, yes, yes.
And also, can I
So,
say this too, Tonya?
sure,
It's
sure.
important for us to be able to share our stories, because many times these things happen to us and we hold it in, right? Or we feel like if we say something, then we're weak or we can't handle it, right? So I really want to encourage us to talk about it, because that is healing, to be able to share your story and to be able to share your story with people who are supportive. So don't share your story with people who are not supportive, right? Or people who are going to go tell your business, but people that really have your back. It's healing, but it's a reciprocal thing. You listen to that person listens to you, right? But to have that, we have to think about what kind of things are we doing in our lives to kind of set up a buffer against all this toxicity around us. And there's resources available for us. There's resources if you want to start thinking about, looking at your resume and revising that, right? I had a guest on my show, career coach Marcy. You can Instagram her, right? DM her. So she has a lot of different resources. I hope it's okay if I say about my job coaching program.
Oh, absolutely.
Okay.
Yes.
Okay,
Yes.
so I also have a job coaching program for Black women who are trying to leave toxic jobs, but there's so much negativity and garbage that we still haven't processed related to the toxic jobs, right? So sometimes we have to process all of that. So we're in a better position to, number one, identify what kind of job is it that I'm looking for? What are the experiences that I've had at this job that I don't want to have the next job? So what kind of questions or investigations can I do prior to going into another job situation? And number three, how do you start healing from all that stuff that happened? So healing is necessary before you can go into a new job and be really open to the different opportunities, and also so you're in a better space to find an environment that affirms you. So if you're
Yeah.
interested in that, my website is liftingasweclimbconsulting.com, and you can connect with me and request a 15-minute consultation, free.
Yes. Yes. Great. Absolutely. And, for those that are out there who have gotten to the point where they realize that they're in a toxic environment and they feel the effects physically and mentally of those situations and the triggering and the negative experiences, I want to just briefly discuss how to go about finding someone they can work with professionally. So
Mhm,
in terms of identifying a good counseling
mhm,
resource,
mhm,
a coach, a mental
mhm,
health professional,
mhm.
what are the types of things you would say would be ways and means of finding out those type of resources? I know you're absolutely one terrific source. But for people who are looking for something, depending on the level of what they need,
Yeah.
so where would you suggest that they begin to look?
Yeah, well, I think it's important to realize what is it that you're struggling with and what are you looking for, right? And recognize too that the resources that you seek, it doesn't mean you can only do one thing or the other, right? Both and you can do multiple things. But if you start recognizing that you're experiencing depression, anxiety, that sense of dread, you don't want to go to work, you're experiencing, your work is becoming a trauma trigger, you feel traumatized at work, that might be a sign that therapy might be a good opportunity for you for healing. Okay, so for therapy, with our insurance, we have mental health coverage with our insurance carriers. So you can contact your insurance carrier and ask them if you specifically want a Black woman therapist. You can ask them for referrals for Black woman therapists. So that's one option. Another option is you can go on Psychology Today. There's an online directory, and you could just put in your zip code. You can see all the therapists in your area. And the benefit is that a lot of us have videos on there, right? So, like a snippet video that you can kind of get a feel for the person. And as you are reaching out to therapists that might, you're like, oh, I think I might connect to this person, make sure when you're in that consultation call with them that you are kind of interviewing them, like to see if they have experience with the issue that you're dealing with. Okay. And let's say you go through that, you meet with a therapist, it's not a good connection. You can always find another therapist. Okay. I don't want anybody to feel like I tried it, therapy doesn't work. Maybe you didn't have a good therapist, or maybe it wasn't a good fit, right? There's also therapy for Black girls. A lot of us are on that directory. And there's also the Boris Lawrence Henson Foundation, which is Taraji P. Henson, the actress, has a
Oh,
foundation to
yes.
really support mental health awareness in the Black community, addressing stigma, and helping access. And periodically, she will have campaigns where you can get 5 free virtual therapy sessions through her campaigns, right? So it's this periodic. I'm on the directory. There's many other Black therapists on the directory, but know that you have to pick a therapist in your state unless they are licensed in multiple states. Okay. So there's a lot of different directories, or you can Google Black therapists near me and find a therapist. So there's a lot of different ways to find therapists. So that's the one thing. Coaches, and particularly life coaches, and I want to be clear that, life coaches, from my understanding, they're not licensed by a governing body, like trained mental health professionals. So if there's any mental health related issue, please go to a trained mental health professional who's licensed, okay? Coaches are more so in terms of really giving you some skills that you can able to apply that information, right? So I want to learn how to do this. And the coach can give you the skills, and coaches are great. I have a coach, you know, a business coach. So those, you know, if you need that resource. And then spiritually, you might need to go to someone like someone in the spiritual, you know, field, you know, in terms of really helping you to connect with, sometimes people start questioning their faith, right? So why is this happening to me? Why is God doing this to me? So they may need to talk to someone about those concerns, but someone specifically trained in that area. So again, really looking at what's going on with you, what is it that you need, and what is it that you're looking for from connecting to particular people.
Right. And I think and I thank you for that, because you're right. You know, dealing with a toxic work environment and the effects of it, there's no one size fits all, you know, solution to this. And it could be a combination of those things that you mentioned.
And I want to say
And
also
yeah,
movement is also very important, movement, because we know
physical
that
movement.
trauma, particularly work trauma, that stuff stays in our body. You know, we have to find ways to discharge it. So if you want to dance around your house, if you want to take yoga, if you want to do whatever it is, but doing something to actively get that stuff out of your body is important.
Yes. And I also, and one thing that occurred to me as you were speaking about those different treatment options is, I think it's vital to make sure that whoever is providing the service to one that is in need, who's in need of healing, that they direct you back to walking in your own power, to empowering you, right?
Yes.
And
Yes.
to giving you back that inner strength, or facilitating the growth of that inner strength. Because what I find often is that in healthcare, many of us find ourselves, you know, alone, in a sense that we may have other friends who really don't know what we're going through. And even our colleagues, that we may do the same line of work, but we may feel a sense of shame or inferiority about expressing our challenges.
Yes.
Right? So like, for example, I may be a nurse, but I may not want to tell another nurse who's a friend of mine that, you know, my coworkers are bullying me, or that I'm starting to feel inferior or second guessing myself, right? That's something that a lot of people would not feel comfortable talking about. So, and then we develop this sense of, you know, a diminishing self-esteem. And, you know, our self-assuredness begins to become unstable, right? Wherein once we used to walk with confidence, we no longer have that same level of confidence.
Yeah. And also, like, Tonya, there's like, because we know there's a stereotype about the strong Black woman, you know, many times we internalize that. And so if we're being harmed and we're hurting about negative things happening to us, then we think that the fact that I'm having a hard time, does that mean that I'm not a strong woman? Are other people going to see me as not being a strong woman, that I'm weak? And so then you have all, well, yeah, so then you have all that stuff that you're trying to deal with, but you're suffering in silence.
Exactly.
Because of it. Yeah.
Wearing the mask.
Masking is so unhealthy for us, but we're so used to it. And Tonya, something that I've noticed for a lot of us, it's this this sense of, you're not gonna run me out of here. You know what I'm saying? I'm gonna show you, you're not gonna run me out of here. But think about, who does that benefit? You know what I'm saying?
No one.
It doesn't benefit you at all, right? And so sometimes we get in this thing of, it becomes like a power thing. Like, I'm not gonna let you do this to me. I'm gonna show you. I'm gonna, you know what I'm saying? I'm just gonna come in and just do my job and then clock out.
To our
You
own
cannot do
detriment.
that.
And it's unfortunate, you know, we do that to our own detriment. And I've seen that, sure. You know, like that attitude, I'll leave when I'm ready, you know. Well, you know.
Yeah, and it's like, well, yeah, you could, But do you want to be miserable every day and
Right.
mask every day
Just to prove a point, right?
just to prove a point, just to show them? And
No,
guess what? You didn't show them nothing because they haven't changed how they're thinking and probably how they're treating you either.
exactly.
Yeah,
Yeah, I think when you make up your mind to do it that way, you carry that burden alone,
absolutely. You're
fortunately.
the one who's suffering.
Yeah, you're the one that's suffering. Yeah.
Mm-hmm.
And then,
Mm-hmm.
we talked about those physical things that happen over a period of time where, even if it doesn't affect us mentally, because many of us have that strong mental status.
Yeah,
Our mind is telling us, like you said, you're not going to chase me out of here.
yeah,
But think about the effect that it can have on the physical body as well. Because
yes,
although my mind is saying, I'm not going to let this person chase me out of here, the
yes,
body is already under assault.
yes. All that
So we have
cortisol
that
going through your
stress.
body.
Yes,
Yes,
those stress hormones are
yes.
activated, that blood pressure is going up, that heart
Mm-hmm.
rate is going up. Sometimes people have manifestations of conditions with their skin. They start
Mm,
getting allergic reactions and
mm.
flare-ups of eczema and irritable bowel syndrome. They don't know why
Wow.
they have this upset stomach all the time.
Right.
Because whatever the mind can't handle, it throws off on the body. So one way
Absolutely.
or another, you lose,
Exactly. Exactly.
you
Exactly.
know, to remain in a place that's not healthy for you.
Right. Right.
Oh,
And Tonya, briefly mentioned this, but think about the impact that you not being happy, you not being fully present, thinking about the job, has on your other relationships, has on your family relationships, your if you have children,
exactly.
all
Yes.
that then carries over until to other parts of your life. So
Yes.
then the work
Yes.
really does start defining your life.
Yes. Yes. And then we wind up stuck in a state of perpetual aggravation.
Yes.
That's
Yeah.
nothing good can come of that.
No, no, no.
Yeah. Yes. So right now, this is all about wellness. This is all about identifying what it is to be in a toxic work environment, what it feels like to be affected by those toxic negative situations, and ways that you can get out of it. Okay.
Yes. And
Whether
healing.
it's
And healing is
healing,
possible and how
yes,
to access healing.
healing is definitely possible, and it comes
Hmm.
in many different ways. But
Yes.
the first step is to acknowledging where you are,
Hmm.
acknowledging how you feel,
Hmm.
and beginning to think about developing a wellness plan
Absolutely.
as
Absolutely.
yeah.
Absolutely. And if you want to hear other Black women stories like Tonya was a guest on my YouTube series. So if you want to be able to hear other Black women, and like I said before, our experiences are common regardless of our profession, area of the country, of the world, right? So if you want to hear other healing journeys of Black women in toxic or from toxic work environments, you can go to my YouTube channel, which is Lifting Us with Time Consulting Wellness Services. And Tonya, I appreciate that you are having this conversation,
Yeah,
particularly for nurses.
absolutely. Thank you too, Dr. Kimani, for joining me today. I believe that whoever hears this, it's going to benefit them
Yes,
tremendously. And if one
agree.
life is changed for the better, we've done our work for today. So thank you
Absolutely.
so much. I would just
Absolutely.
appreciate your time and your energy and your commitment to helping Black women heal.
Absolutely. Absolutely.
So I'll just remind our viewers once again to like, subscribe, and share to Nurses Speak. This is your channel where your voice can be heard and no topic is off limits. Thank you.